home care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show here for June 9th, 2020. Without further ado, I'm going to welcome Dr. Shahnaz Fatteh to the program. She is an asthma, allergy, and immunologist. Wow, I don't think we've had that combination on the program. So without further ado, Dr. Fatteh, welcome to the program. How are you doing this evening?
I'm doing wonderful. Thank you so much for having me this evening.
Thank you, and I always say for joining us on this adventure of health, because we always learn so much for the doctors, and also a thank you early on for taking the time. I know you're very busy and you worked hard to get on this show, so I really appreciate it, making a little bit of time here. So you're board certified really and immunology. Tell us a little bit about the specialty, because we have a lot of heart surgeons on this program, neurologists, and I really feel like I'm bringing a really open discussion on something new to my viewers and listeners. So tell us a little bit about your specialty, because it is very specialized.
It is, and thank you so much for asking me to share this. Allergy and immunology encompasses so many diseases, and it impacts an incredible amount of our population. So if you think about allergies, people can have this from when they're small. To have a child who has food allergies, allergy to peanut or milk or egg or soy when they're small. There's something called an atopic march. Many patients go on and have eczema and skin rashes, develop allergic rhinitis, and then asthma. So it can be a continuum of illnesses from childhood into young adulthood and even into older ages. So we see a spectrum of diseases such as eczema, atopic dermatitis. Patients get itchy, they get hives. So we see chronic and acute hives. We see folks who swell, who get angioedema, who swell in their face and lips or airways. Of course, we see anaphylaxis, the really serious allergic diseases that patients may have to food allergies or to medications. And outside of all of that, we see all the various manifestations of airway disease, including asthma. And so we have a lot of overlap diseases. And the immunology part of it's really important. Immunology is kind of cutting edge. It's the future of medicine. And so a lot of techniques and labs and assessments that we do help us find patients who may not be diagnosed, who have serious immune dysfunction. And they may be presenting with pneumonias, wounds that don't heal, recurrent sinus infections. They might have had multiple surgeries and have other underlying disease states that we need to evaluate and find. And probably the most common thing that most of us are affected by, especially living in Florida, is good old allergic rhinitis, hay fever type symptoms, except here, less seasonal, more year round.
Yeah, I think we've all, known someone who's had those type of ailments, or, it seems like every year, I always put a little anecdote of my life in here. I'm from South Florida, and sometimes when the rainy season starts and it's like the whatever washes off the trees, sometimes I get a little something there. So I probably should put you in my Rolodex here and give you a call next time that happens, because you could probably figure it out rather than suffer from it. So, there are a lot of different, ailments, diseases as well. You mentioned, you kind of talked about how, asthma and other these types of ailments that you treat can start at an early age. Now, do you treat a huge range of patients? Do you have a pediatric and adult?
Yes. Absolutely. I have probably 50-50. We see all ages from infancy. And the oldest patient I treat is around 98 years of age, who still comes to me. So very sprightly woman, you know. And she says the key to old age is really that she always walked and exercised and ate whatever she wanted to.
That's great to
So
hear. And she's, taking her health care in her hands, and she's got a great quality of life because of it. She's seeing a doctor like yourself at 98 years old. That's great to hear. And then all the way, to the other way, early on in life, you're able to see patients. We're here with Dr. Shahnaz Fatteh. She is Asthma Allergy Care Center is the name of her practice. Great website. Got a lot of info there. And I always mention when doctors have great websites, asthmaallergycare.com. The number is 954-723-0334. We started out talking a little bit about asthma. If someone doesn't have it, what are some of the signs and symptoms? And is this something you're born with, or you can develop at any age? I've always been a little baffled by that question. I never really known really anyone, luckily, with asthma. I've heard about how, tough it is to live that way. But if you get the right kind of care, you got a doctor like yourself, you can, again, manage a better quality of life.
sure, that's a great question. I mean, asthma for most patients, there's always a genetic predilection. That means a mom who has allergies or has asthma, or both parents if they have allergies. So we inherit a tendency to develop allergies and airway dysfunction. But really, it comes to the exposure that we have. So we know early cigarette smoke exposure can predispose young children to start developing airway dysfunction. And exposure to allergens, particularly environmental allergens, at a younger age, high concentrations can drive this, as well as viral infections in children. Children school age, pre-primary, they have the snotty, runny noses, they cough and they play with each other, they touch everything. And so we know that they get a lot of different viral infections, and certain viruses have a greater likelihood at different ages to trigger increased airway dysfunction that leads to asthma.
Okay, good to know. And tell us a little bit. I see the COVID-19 poster in the background, and that is obviously the timely topic of this time. Tell us a little bit about immunology and COVID-19 and how you're helping with care in the community. And I know you have some views you'd like to share as well, because you're also president of the Broward County Medical Association. I should have mentioned that before. So wow, this is great to have you. So if you could just touch on those, that'd be great.
No, thank you. So I guess a couple of things I can say. As president of the Broward County Medical Association, we really thank you as an association for having me on air today and to share some of what we're doing. As an organization, we're involved in reflecting the concerns of physicians and healthcare providers throughout Broward County. And really, our primary goal is to help our patients. The bottom line is to make sure our patients stay healthy and well, and that we can educate and be part of that dialogue for our community as we all tackle this pandemic. COVID-19 immunologically, of course, you've seen an array of things on social media as well as television, newspaper reports, on the radio, TV. We've seen this is a challenging disease, and it can affect, we initially said, oh, it's over 60 and 50 years of age, but as you can see more recently, pediatric cases have also been described. And so the presentation can be varied. It can lead to blood clots. It leads, of course, to respiratory failure. And, as an allergist, it's been a challenge. We expect patients during hay fever and spring season, tree pollen, to start having runny noses, nasal congestion, cough. Our asthmatics may get short of breath. So differentiating our COVID patients who have similar symptoms from our allergy patients, of course, has been a diagnostic, area that we've had to make sure our patients are also aware of how to differentiate those symptoms. The BCMA has been fortunate working in the community because we've had a tremendous response. We've done a few things, which is one was the mask drive. We had local churches and folks that in the community spent hours investing their time to donate 15,000 masks that we were able to bring to hospitals and care centers so that we could make sure everyone had masks when we've had undersupply of some of the basic steps we need to keep infection from spreading. We've also been able to bring those to our hospitals, and uh, they involve teenagers, high school students, senior citizens, all different ages, taking their time to make these masks. And, they actually made them with a pocket that had a HEPA filter so that it would be more useful. And so that's why we were able to donate these to the hospital as well, because they could take the filters out, clean them, wash the masks, and reuse them. So it was very clever the way that they've set this up, but that was one. We've also set up something called the Broward Response Unit. I don't know if you've heard of that, but that is approved by the HHS, the federal government, and with Broward County Health Department, as well as our state Florida Department of Health. And we're the housing authority. So what we've done is we've credentialed a number of individuals who are volunteers, so that if we have a pandemic or any kind of major issue, even hurricanes, this is South Florida, we could have a Cat 4, Cat 5 hurricane. And so this allows us to have a team ready to respond to any crisis in our county of credentialed individuals. So we've got retired firemen and women, we have nurse practitioners, PAs, physicians, respiratory therapists, and volunteers in all different avenues, including, health tech. We need people who are engaged with accounting, any number of backgrounds. So that's been really rewarding to work with in our county.
That is great with the credentialed help, as well as thank you for saying that about the face mask as well. I got to give kudos to you first as a doctor for going out there and doing that in your spare time, and then also working hard to do that as well. And then also I got to give kudos to the community, because the last few times I'm barely starting to get out, noticed a lot more people wearing face masks and a lot more people taking it seriously. And that may just be, me noticing that, but it's definitely something I noticed from a difference in a month or two ago. So I think, with all the help, we can hopefully, flatten the curve. I also want to mention, because we talked a little bit about your office early on. Now, you have a multilingual office, which I think is just genius for South Florida. Correct me if I'm wrong, but English, Spanish, Creole, and is it Arabic as well, that the languages that are...
No, not Arabic, Urdu.
Okay,
yes.
Thank you.
We've got Spanish, we have Creole. My one employee also does some French. So, it's been really nice. We kind of are multilingual, multinational here, and that helps us when we have patients. We have a lot of people that come from Canada that are coming from here during the winter months, and many of them speak French. And so it's really helpful for us to be able to see folks from different backgrounds and different areas in the office, so that we can actually get real information about what's going on with them. I certainly am not fluent in everything. I'm fluent in English, and I speak fairly decent Hindi and Urdu, and do a decent job of medical Spanish. So,
okay, well, you have a team there, that we all work as a team. We all try everywhere we work, but it sounds like a great office. And then also 24-hour, 365-day on-call provider availability. That's fantastic.
Yes.
Oh, that's great.
So, patients call the office. In fact, during this entire telehealth, has been something that we've adopted. And I made a point, and my patients know this, we call them, it's from my cell phone. They have my cell phone direct access. It's really been because we've all had to adopt how we take care of our patients. We've had to adopt and reduce some of our office hours and availability. But I certainly did not want any accessibility to be curtailed. And so by doing it from this route, if patients call the office, they need to speak after hours, you're always speaking to a clinician directly. And if during this time, my active patients who've been with me, if they need me, they can also, call me directly if they're having any difficulty getting through the usual channels. They have my cell phone. And so I think it's a commitment to make sure that continuity of care and any of my patients' needs are being met as timely as we can for them.
Now, Since you, I mean, I'm saying that you're specialized. I'm kind of, on the outside here, but do we need a referral to see you, or we can just call the office and be seen? How does that work? Because are you in the primary care umbrella, or do we need a referral?
So I am a specialist, and so depending on your insurance plan, you may not need a referral to see me. So there are some plans, however, that your primary doctor will help direct you to see a specialist, and those you do need a referral. So it depends on each insurance. Certainly, my practice, we take, Medicare, Medicaid, all the Medicaid uh, plans that are for the state, part of that. And of course, we see all the traditional insurances as well that are commercial. So, we accept pretty much just about everything that's available in the state of Florida. I don't have any programs that I don't accept because we want to be able to see all patients in all ages.
Wow, that's great to know, and that's great for the community as well. We're here with Dr. Shahnaz Fatteh, Asthma Allergy Care Center of Florida. The website is asthmaallergycare.com. Go on there. There's a ton of information. I mean, in a 30-minute program, I couldn't get through all the areas of interest that you treat. If I listed them one by one, I probably wouldn't be able to get through them. And that's an amazing resource for not only the Broward County community, but South Florida as a whole, and the world as a whole. Because that's just amazing how many areas of interest. I was just blown away is the way to say it. Again, the number is 954-723-0334. I wanted to, we're getting a lot of information out here, and that's great. I wanted to ask you, and I didn't put this on my show question prep list, but how did you get into asthma allergy care when you were in residency or et cetera? What was the thing that kind of led you on this path, or was it something that you had targeted beforehand?
No, I can honestly say, David, it was not my first choice. I thought that I would go into something surgical, and I really thought neurosurgery. And when I was in medical school, I trained at the Medical College of Georgia in Augusta, Georgia. Went to college at Emory University in Atlanta. So when I went to medical school, my roommates had a cat. So there were three of us, and the cat particularly liked my room. And unbeknownst to me, by 2 years into sharing this room with the cat in the apartment, I started developing rhinitis, eczema, asthma. And I would go running and I would get short of breath and winded and start wheezing. And so I luckily ended up at an allergy clinic for a rotation. And on the very first day, recognized that the symptoms that I had seen in all these patients all day long, shadowing my clinician, I had the same symptoms. So I was immediately tested, and the cat was just huge. And I realized this was cat allergy, and that was what was provoking my symptoms. And really, I realized that patients get lifelong, they're affected by this condition. And I certainly was. And so it provoked an interest in why I wanted to study allergy and become an allergist. And I experienced it firsthand. So many of the therapies and concerns that patients bring up to me or that we offer, I have gone through it myself. So I understand the pluses and minuses and, can hopefully speak to our patients in a way that they know I relate to it. And I think that's been helpful. So I also became allergic to latex. We used to, back in the 80s, the gloves that we had were powdered latex. And so, of course, that would make me sneeze and itch and cough and wheeze. And of course, you can't be in an operating room doing any of those things. That would not be sterile. So surgery went out the window very quickly. And I enjoyed the fact that allergy, we got to see our pediatric patients. We were helping folks. And this is a field that you really can make an impact and you see the positive benefit. And so it's really quite nice. And being able to follow somebody who's young as they get older and see them developmentally succeed and attain the goals that they want to. A child who has early asthma, who's going to play soccer or playing sports and doing everything they want to do as a youngster, that's very rewarding.
I've done this show for 4 straight years, and that is exactly what you want to hear from a doctor if you're looking for one. Again, it's Dr. Shahnaz Fatteh. AsthmaAllergyCare.com is the best place to to look online. 954-723-0334 is the number. So allergy testing is tell us a little bit about that. Is that done in the office, and how does it work?
So, sure, skin prick testing is the standard to find out if you have become sensitized to an allergen. So, the important part is that when we do allergy testing, that we also make sure we have your full clinical history and that the two have, concordance, right? That if you're having something, a lot of people can test positive to different allergens, especially if you live in South Florida, you may be reactive to different allergens that you've seen year long, but not necessarily have any symptoms. So when we do allergy testing, it's still the standard prick test. We also have the methodology to be able to do it by blood tests. Blood tests have become much better and also more accurate. And so for those folks that cannot do testing because medications or skin conditions that don't allow us to discontinue certain medications for them, we can also do it through a laboratory methodology. So we've got good options.
Yeah, great options there. Again, Dr. Fatteh on the program. We only have about 2 minutes left, so I got to my curveball question at the end there. What are your hobbies and passions in life outside of medicine, or do you even have any time? Because it sounds like probably not. Very busy.
It's terribly busy, but I do like to have fun. I think my this COVID-19, as terrible as it's been, the one silver lining, if you will, is my kids are out of school and having them home from college and down here to be able with us to be able to cook and try new recipes and meals together. That's been great. I like to exercise and I like to read and paint. So those are kind of my hobbies. So now that I have a little bit of free time every now and then, trying to dabble a little bit more in that.
That's great. And again, Dr. Fatteh with us. Where did you go? Your education and training, medical school, etc. We got about 45 seconds.
I did undergraduate at Emory University, medical school at Medical College of Georgia. We came down to UM to do internal medicine and allergy at Cornell University.
That is very impressive. Well, again, Dr. Shahnaz Fatteh, thank you. Again, it's asthmaallergycare.com, 954-723-0334. And thank you for joining us. That was fantastic.
Thank you, David. Thank you so much. And I hope we can help anybody who needs to. So I'd be happy to see them.
Yeah, we'll let them know about you. Again, we'll see you next time on the You and Your Doctor Living a Longer and Healthier Life show. Stay safe.
Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422 and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed